Well, let's speak more about International Nurses Day now with Denosa's Bongani Mazibuko. Bongani, a very good evening to you. Welcome to The Full View. I wonder what's top of mind for you on this day, on what's supposed to be a very special day for your members.
Good evening, and thank you for having us. It is definitely a very special day for us as Denosa, and as nurses. And at times, I think the highlight or the attention on this day tends to be on the negatives, the challenges that we are facing and so forth. But we want to sometimes shift the focus on appreciating the work that the nurses are able to do under very difficult circumstances in health. So as much as we want to complain and send and cry out with the challenges, but we also want to say that we want to appreciate the nurses and tell them that we appreciate the work that they're doing under difficult circumstances.
How often do nurses, in fact, in this country feel that there is an appreciation for all that they do?
Very little times, because I think the last time nurses were appreciated properly, or not even properly, but just to get a glimpse of it, was during COVID. At that time, they were hailed as heroes because when police stations had a positive case of COVID, they closed down. Educational facilities the same, but hospitals were the only places that functioned 24/7 under difficult circumstances. And even now, we see nurses being attacked in the workplace. We have a lot of challenges as nurses, but nonetheless, we still go and we try and do the best that we can.
It's interesting, right? Because you want to focus today on your appreciation for what the nurses are doing at hospital and clinic level, but what would actual appreciation look like beyond a day such as today?
Actual appreciation would be employer committing to making sure that there's safety in the workplace. We've submitted suggestions to the government to mitigate what we are saying when we're talking about safety, positive practice environment, whereby they improve infrastructure where the people are working, mitigating issues of shortage of nurses. Those are positive things that would show appreciation, because that would be investing in nursing and looking after the nurses and making sure that they are functioning in an environment that is conducive.
How serious is the shortage of nurses? Because even in the recent budget allocation, there was some money set aside to employ healthcare professionals, but some of the unions, like yours, I think at the time, came out almost immediately to say it simply did not go far enough.
It's not enough. When we are saying that when the National Minister of Health comes to us and says that he's going to employ 200 nurses, that is a tip of an iceberg. 200 nurses would be adequate for a hospital like Chrisani Baragwanath, and that is not even enough for the province of Gauteng alone. So it's in our view, it's not enough. We would have wanted to say that 1,200 that they're saying is for doctors, that should have been the amount that is being allocated to nurses, because nurses are the ones that spend a lot more time with the patient than doctors. We're not saying that doctors are not important, but we're saying that nurses are the backbone of the healthcare system, because they're the ones who make sure that they spend time with the patient, and they're the ones who have to nurse those patients back to health. And primary health care is based on nurses, because we are the ones who are focusing a lot more on prevention.
And do you think the introduction, as we wait for it to start, of the National Health Insurance will better the conditions for nurses? Because some of the suggestions have been that with an NHI program in place, there would be less pressure on nurses because more positions would open up, so more jobs. So the patient-to-nurse ratio might be brought down. But those who argue against it say there would be fewer opportunities, for example, in private healthcare. Where do you think the NHI will leave nursing staff?
We believe that NHI would alleviate the pressure on the healthcare system, not necessarily nurses only, because if you look at it, there'll be much more access to the healthcare system, not only limiting it to the public service, allowing those patients who have options to be able to go in the private health sector as well. But in terms of nurses, we believe that it will allow nurses to be able to see patients in a much more relaxed environment, because if you alleviate the pressure, reduce the number of patients that are stuck in one area, which is the public sector, allowing them to get access elsewhere as well, then it means that the nurses are not under so much pressure to perform and see those patients as quickly as they would have had to under normal circumstances.
And is management at private hospitals hearing you? Is government hearing you when you raise these concerns?
I would like to say that they are not here. They are hearing us, but there's a reluctance to act. If you look at a situation like now, whereby Gauteng returned money back to Treasury, and yet we were raising issues of shortage of staff. We were struggling with the Department of Health to retain nurses and doctors, and yet there's money that was sent back to Treasury. To me, it then means that someone somewhere is reluctant to do what they're supposed to be doing. We cannot say that we are struggling with the shortage of staff and there are people who need to be appointed, people who are trained by this very same government, and yet the government fails to employ them and retains money. To me, that is failure. It's dereliction of duty. So someone somewhere should be held accountable if they were hearing us, because it's a clear sign that they don't want to come to the board and actually help the nurse, the department, healthcare services to improve in this country.